You're listening to All the Pieces, a podcast created to keep you informed. Now here's your host, Chief Quality Officer, Dr. Karan Mohan.
Hello and welcome to another episode of All the Pieces. I'm your host and Chief Quality Officer, Karan Mohan. Today, we are shining the spotlight on a valuable service here in the community called the Community Healthline. Let's start with my brand new guest here, Christy, and I know we have a repeat customer here, so we'll get right to you, Cheryl. Go ahead, Christy.
My name is Christy. I've been with the Community Nurse Line since 2018, and I've been a nurse since, for 30 years. So
Excellent. Thank you, and it's Nurses Week, depending on how the podcast airs, but I'll still give you kudos. But thank you for all the time and effort in the profession. And Cheryl?
Hi, I'm Cheryl Daniels. I am Director of the Community Healthline, Hospice, Care at Home, Palliative Care, Serious Illness Management, and the Mosaic Van. So happy to be here again.
Did you miss anything? The things you covered? Or
I think I covered it all.
I think there's dietary and women's services that you might have missed.
Stop.
All right, so I'll start with you, Cheryl. What exactly is the Community Healthline?
So the Community Healthline is a 24/7, 365 Ask a Nurse line. We have nurses on staff all those hours. We also have a non-clinical staff called the Community Health Management Assistant Group that helps us too. And we take calls from the community. We also are the after-hours answering service for all Mosaic providers and some non-Mosaic providers. But the cool thing about the Community Healthline is that it's interconnected. We use the same EMR. We use Epic. Not only if you call and you are trying to get a hold of your provider because you've got an ache, pain, sniffle, we have guidelines, physician-driven guidelines, and we can offer advice. We can make suggestions about where you seek care. Community Healthline's been in existence since 1997, actually.
Wow.
And it was created when we had Community Health Plan, when we started to have our own insurance company, and it was created to do referrals, prior authorizations, and those kinds of things.
Oh, wow, all the fun parts of the
and we've just
medical journey.
Yeah, and we've just evolved since then to become a one-stop shop for the community. Another valuable service that we do is if you've been in the hospital and you get your discharge summary instructions, our number is on there. So if you get home and you think, God, am I supposed to take this medication or not? You call that number, you're going to get Community Healthline, and we're going to have the nurses on the phone helping you get that information. So our goal is that we can help our caregivers seek care at the least cost prohibitive place of service. We don't want to drive everybody to the ER. We don't. So if there's something we can do to call your provider, that's what we're going to do. If we need to schedule you an appointment and we're able to do that, we're going to do that. So it's a great service. And our health management assistants, the non-clinical folk, that's oftentimes who the caller speaks to first. And they are so capable and so willing to help. And we schedule the van, we schedule appointments. I mean, it just goes on and on and on.
Wow, so that's quite a breadth of scope in terms of how they help.
Yeah.
Christy, turning to you, what type of calls are you routinely seeing when somebody calls the Community Healthline?
Well, it's a vast array. Just this morning, I spoke with. Early this morning, it was people about appointments. It was about a child being sick. I talked to a palliative care patient. I talked to a home health patient. So it's a vast variety of calls that we get. So.
And does it only for the patients, or is it just for anybody?
Oh, it's for anybody. I've had callers from Florida. They get on, they Google and find a nurse hotline number. We can give them health information. We can assess them over the phone and do a triage on them. So yeah.
Well, it's a benefit. I mean, you have to think of it as part of your Mosaic benefit. For example, we take employee health calls. So if you call in at night, you're going to get one of our nurses, Community Healthline nurses, and they know the requirements. Do you need to go to the ER? What forms do you have to fill out? Do I need to call in sick? I mean, we know all of that stuff, and we can really help caregivers navigate that, know where they need to go to seek care, and that kind of thing. And, we are self-insured. I mean, it behooves us all to seek care at the right place and at the right time so that we don't overspend when we don't have to.
Right.
And it helps caregivers too. Who wants to pay that copay if you don't have to? If it's something that you can call at 3 a.m. and you can be seen that next day at the doctor's office,
Right.
it's a win-win.
So you help individuals, caregivers aside, connect to their providers.
If we can.
So it sounds
Mosaic providers.
So it sounds like the community helpline really is a hub for anybody who has any question about their medical journey, whether it's from appointments to should I go to the ED, can you help me with transportation, can you help me with my medications, understanding them? Is that right?
Yeah,
Yes.
absolutely. What's really cool is when people move from here, but they still call us.
Yeah.
That is the biggest compliment ever, because they know our service, they like our service, and they keep using us, and it's very cool. There is so much involvement with the community health line, and thank you so much for letting us talk about that, because
Absolutely.
sometimes I don't think everybody understands all the pieces that we have.
Oh, a little plug for the podcast. I'll take it.
A big plug. Because we're there someplace. Anything telephonically that goes on here at Mosaic, we're there somewhere, like I say. And, my staff know me. I never say no. I'm always going to help out, if it's starting a new clinic or a new service. And there's something that we can help make it smoother for our customers and our patients. Biggest patient advocate you ever find right here. We're gonna support our patients, and whether that's
Absolutely.
after discharge, before they come in. For example, if you're having a GI lab procedure and you aren't clear on the prep that you need to do before the procedure, our number's on that instruction sheet, and they're gonna call, the patient and or family will call, and we're gonna help you so that when you get to have your procedure, you're ready.
Right.
You've done it correctly.
Something else, though, that I like that we do is we do outbound calls. We follow up on patients that are discharged after they've been discharged from the hospital that are high risk, like, COPD patients, CHF patients. And we do a lot of teaching. And patients want to get out of the hospital, and I get it. I mean, I want to get out. And so they don't always hear everything. And so when we can take that time after they're discharged and go through their medications and go through their stoplights and things to watch for, they hear it more, and they're very, very thankful for that.
You mentioned stoplights. I know what that is, but for our listeners, can you describe what that is?
Oh, a stoplight. So say like for a COPD patient, it's just like a stoplight. Your stop sign. You've got your green zone, your yellow zone, and your red zones. And your green zone, you're doing good. You can stay at home and you can continue your treatment like you should. If you're in the yellow zone, then maybe you need to take an extra medication or let your doctor know. And if you're in the red zone, then you're probably going to the emergency room or being seen at your doctor's office. So,
So there's kind of like a spectrum of signs to look out for.
Yes.
When to seek care and when to go to the hospital.
Yes.
Excellent. So, how is this different, say, from a patient calling to their regular doctor's office?
Well, we're after hours. They're going to get us when the physician's office is closed. That would be weekends, holidays, after hours. So, and we're integrated. When you call us after hours, it's like getting your doctor's office because we use the same EMR. We're going to know what meds you're on. We're going to know when your next appointment is, and we're going to know all those things. So it's seamless to the patient.
So you see what they see.
Yeah, yeah.
And we all know, that discharging day is probably the most hectic day for a patient.
Yes.
They get a stack full of papers, possibly new medications, transportation's trying to be arranged.
Yeah.
If they're not going to a facility or a rehab unit,
Yeah.
they try to get in touch with a family member. A lot of things get glossed over, not by design, but just by the processing of the patient.
Just the timing.
So this call line is really helpful for them to digest and say, okay, now what do I do now that I'm home, and help them coordinate.
Well, we get lots of calls too. Is as we expand. I mean, think about it. We've added acute rehab. We have LTAC. Our relationship, the system approach to Maryville and Albany. Sometimes folks need help navigating us.
Yeah.
I mean, we're complex. We know the scope of that urgent care can provide. We know the scope of when you need to go to the ER.
Right.
We know when you can wait to see your provider the next day. And those are physician-driven guidelines that we use. Best of breed. Everything's tested and vetted by our docs.
Excellent. So, we hear about access a lot in our conversations around the community and the hospital. How does this call line help with access?
Well, we've just recently started here at Mosaic a continued care clinic, and that clinic has been established to see patients who don't have PCPs. And you can go there after you're discharged from either the ED or the inpatient side, and they will follow up with you to make sure you're doing well on the treatment that's been ordered from you, whether it be a new medication, maybe you need some test results back, or maybe you need more testing done. They'll keep in contact with you and see you for about 3 months to make sure that your health care needs, and hopefully during that time we'll be able to establish you with a PCP. It's hard to navigate, and
it is.
And we have a time frame. We don't want you going home and not having anybody manage your care for long periods of time. So the continued care clinic is amazing. I mean,
Right.
they will see people within 24, 48 hours after discharge. And they're there to help keep you out of the emergency room and help see you and help work on establishing that PCP relationship.
They will get you in touch with home health if you need home health, and follow you that way, and if with any specialty clinics too. So.
Yeah. And that's the good thing, too, is we are also the answering service for home health and hospice.
Yes.
So if a patient calls in and they need help, and in the EMR, we can see that you have Mosaic Home Health or Mosaic Hospice, we can get somebody to your house should there be a need for that.
Yeah.
So, again, it's so interconnected, and I just can't tell you how proud I am of this staff.
Yeah, it sounds like to be, and it should be.
Between the nurses and the health management assistants, they genuinely care about patients, and a lot of people don't realize all the pots their hands are in.
Right.
And it's just an amazing service that we're allowed to provide. Mosaic is very generous because, there's not a lot of revenue being brought in by this. There just
Right.
isn't. But what happens is we provide the best and safest care by having this service.
Absolutely. And
And
we
it's-
all know that transitions of care is the most area where you have drop balls, so to
Yes.
say. Christy, I want to ask you, what's the average number of calls you're getting a day? Or is
That
too
is a
tech-
question for you.
You
'Cause-
personally, though, what's an average that you get?
Well, I'm day shift, so during the week, the majority of the calls go to the clinics. So I would say probably from 30 to 45 during the week for me.
Yeah.
On the weekends, jump that up to 60 to 90.
Wow.
We
Yeah,
do
at
about
least.
20,000 calls a week.
Yeah.
Between
Wow.
the health management assistants and the nurses, some calls are longer,
Sure.
some calls aren't. I mean, if you're scheduling a van trip, say somebody's being discharged, that call may take 5 minutes. Now, the nurses, when they do their telephone triage and they have to investigate, probe the patient for what's going on, med review, that kind of thing, some of those calls can take 10, 15 minutes, depending. Yeah.
So it sounds like a great, I hate to use the word customer service, but
But
it
it
truly
is.
is that
It
because
is.
Mosaic being a full spectrum health organization, we have all the services. Someone has to know where all those pieces fit for the patient, right?
Nice plug.
There you go. I'm taking your lead on that one, Cheryl. I'm full of puns. And Christy, going back to you, you've been doing this for quite some time. What challenges you see coming down the pike as you see this program, as we offer more services, more, gamut
The
of...
challenge?
Yeah.
Well, what did I tell you the other day? I think we have 85 processes. We have a web-based process for us so that we can update it right now. We can make changes right now as needed.
Because a lot of them work from home. So you have to have, yeah.
And so we've probably got 85 different processes, and in that process, there can be 20 to 50 different things under that process for each different clinic that you have to be able to access to know how that provider wants things or how that clinic wants things handled. Because not only Mosaic, we have 6 outside clinics that we service. I think Sunflower has around 35 docs that we do answering service for also. So just the the knowledge to be able to remember
the whole thing.
remember and be able to go to and pull the information that you need to care for the patients properly.
So there's a lot of wealth of knowledge of how process, and not every clinic is the same.
No.
No.
I don't know that there's one clinic that is the same, even within Mosaic.
Right,
Yeah.
and that's something to be said about the uniqueness of every
Yeah.
interaction, and
Yeah.
every patient too. It goes the same way for providers
Oh, yes.
as well.
Yes.
And we have a really good relationship with the Social Welfare Board, well, Stuber Healthcare Clinic now.
Stuber Healthcare,
and
yeah.
so that, where they're answering service, and we work with them very closely so that, again, we want to be payer agnostic. We want to make sure patients are seen where they can afford to be seen. So
Right.
if we can help a person who doesn't have insurance go to a place where they feel comfortable, where they can be seen and not ask for a copay, we want
Right.
to do that. And they're great partners. Dr. McMillan's wonderful to work with. And
I do love Dr. J.
Yeah, you got to.
Yeah.
You got to.
And that's a great equitable approach to patient
Yeah.
care. Not everybody has the same insurance plan or
Oh,
same
no.
diseases, the same demographics, but the care access should be the same for all of them.
Absolutely.
That's excellent. So
that's why I love being part of it.
I would be remiss
Very
to say, what is the number for the call line?
816-271-4000.
Excellent.
Call us 24/7, 365.
Cheryl is waiting. It's only $9.99 a minute. Did I age myself with that reference? So, what's the most oddball thing, Christy, you've helped a patient navigate? Because I love these type of stories. I always find out somebody's like a pet groomers or something about a van or anything like that.
Well, let's see. When before the election, you get a lot of political calls. People want to
Really?
talk. Oh yeah, they want to talk. And
They want to just talk.
they just want to talk. I mean, they start about something and then they end up talking political, and I'm just like, I got
Let's
another
keep it
call on
about
the
the
line.
health.
Yeah, I got another call on the line. I think we'll talk about this another time.
We record all our calls, and I can listen to them. And I think the funniest one I've ever heard is it was like a latchkey kid. He called in. It was like 6, 7 o'clock in the evening, and he was having trouble with his algebra. And the nurse on the line was trying so hard to be supportive, but it's like, gosh, I haven't done algebra for.
What is a hypotenuse? What a long division? Anything else? Christy, I'll start with you. Do you want the people to know?
Just communication. I mean, we all know it. We all know that communication is probably one of the biggest and most important things in any business. And so with healthcare also, and I love it. I know our docs are very happy with our service. I think if you speak to any doc that has our service, they're very thankful for the nurse line because I think we cut down on their calls.
Yeah.
But I love being able to to chat with the hospitalist if something didn't get taken care of the day before, as long as they're still on, being able to do that communication, but communication with leadership and clinic managers and all of that it's so important to know that we all are integrated, and it's so important that we all know what changes are going on, even if it's a small change in your area. It affects us because when customers call in, if that changes in your area, then if we don't know about it, then you just see that breakdown a little bit. But if not, when we communicate so well, you see how everything works so well together. Right. And so we just want to continue that. And so that's kind of another reason why we're doing this, just to show how communication with all of us works so well together.
Excellent. Cheryl?
I echo what Christy says, and I have to say we are so blessed here at Mosaic to have this service, and I hope our fellow caregivers look at it as a benefit, because
I think they do.
Yeah, because it is, and
Yeah.
the interconnectivity is great. It just really is.
And as a hospitalist, I can tell you, without the community health line, a lot of the work that we do in inpatient would not be translated as well on the outpatient side. So as a group, we thank you. And for all the listeners out there, just know that just because you're in the hospital or the clinic, your healthcare journey doesn't stop. It takes a whole team of people to coordinate that, to put a nice little bow around it because there's a lot of pieces that are moving at any given time. And the Community Health Line is just one of those excellent services we have here at Mosaic. If you have any other questions about it or just want to talk about politics or how to cook a turkey or do your long division, Cheryl, the number is?
816-271-4000.
Excellent. I encourage you all to use that service within reason and whether if it's medically appropriate to help you in your navigation of the healthcare journey. I want to thank my guests today, Christy White and Cheryl Daniels.
My pleasure.
If you have any questions, please reach out to them. Don't call me. My number is not listed. I hope it's not. And until next time, folks, take care and brush your hair. Excellent.